To these topics. What is Lisch nodules? Lisch nodules are iris hamartomas. What is a hamartoma? Hamartoma, the word per se, when you hear it, it means that tissue which is originally present in that area, but there is a disorganized growth of the tissue. So the tissue, that is iris hamartomas, they are going to be present as, so if this is the iris, then they are going to be present like bundles or nodules. So those tissue which are present in the iris, it is that tissue which is originally present in the iris only, but that has undergone a disorganized growth. So disorganized growth of the original tissue is hamartomas. So where is this condition seen? This is seen in neurofibromatosis 1. What about Brushfield spots? Brushfield spots are connective tissue which are present on the iris. So why should a connective tissue be present on the iris? That is because this is associated with Down syndrome, and that is the defect which we see here. That is the Brushfield spots. What about orbital cellulitis? Orbital cellulitis, there are two types. One is preseptal and the other one is the postseptal. So now we are going to talk about, there is a tarsal plate in the eyelid. So when it occurs that is just in front of the tarsal plate, that is preseptal. So this in front of the septal plate, then it is preseptal. So this is less dangerous, but the septal one is very dangerous. So they might give you a picture of the septal orbital cellulitis, and they will ask you for the condition, which is orbital cellulitis. What is the cause? The most common organism causing orbital cellulitis is Stye. What is the treatment? Orbital cellulitis is a medical emergency. It has to be treated with IV antibiotics. What about hordeolum or stye? Hordeolum or stye is because there are oil ducts in the eyelid, right? So when those oil ducts are obstructed, but because of an infection, oil ducts are obstructed because of infection, that is stye. Now what is the infection that is causing stye? Again, it is a Stye. Even though an infection is causing this hordeolum or the stye, the treatment is warm compress. Why? This is because even with warm compress, those accumulated secretions will dilute and it will flow, and because of that the infection itself can resolve on its own. The body can fight back if we give warm compress. What is Chalazion? Chalazion is oil duct obstruction, but it is not due to any infection. Just per se, when there is an oil duct, that is the Meibomian glands, when the oil duct or the gland is known as the Meibomian gland. So when that is obstructed, then it is known as Chalazion, but it is not due to infection. So you know what the treatment is. The treatment is again warm compresses, because just with mere warm compress the secretions are liquefied and the body will resolve the condition. Fine. So these are in detail about these 5 terms, and any one of this question can be asked. All the best for your exams.